Hello everyone and welcome to today's lecture on agriculture poisons. Agriculture chemicals or agrochemicals are chemicals used in agriculture. When ingested in toxic doses, they may cause serious poisoning or death. Agriculture poisons include fertilizers, pesticides, grain preservatives, etc. There are innumerable substances which can be included under the term agriculture poisons. But this lecture concerns itself only with some of the relatively important examples encountered, that is, organophosphorus, organochlorines, carbamates, and pyrethroids. Now, classification of the agricultural poisons. So, broadly, they are divided into four categories. One is chemicals or plants used as fertilizers. Second one is chemicals used to kill pests, that is, pesticides. Then chemicals used to disturb the feeding or growth or mating behavior of pests or used for other miscellaneous agricultural purposes. And the fourth one is poison associated with preservation of grains. So we'll take one by one. Firstly is chemicals or plants used as fertilizers. Examples are nitrites and nitrates, ammonium sulfate, and hydrous ammonia. Then examples of pesticides. First one is acaricide, which are used to kill mites and ticks. Second one, algicides, used to control algae in lakes and canals. Then fungicides, used to kill aphids. Then avicides, used to kill birds harmful to agriculture. Then along with this, we have bactericides, fumigants, fungicides, and herbicides. And lastly, we have insecticides. Examples are organophosphorus, organochlorines, and carbamates. Now, third category is chemicals used to disturb the feeding or growth or mating behavior of the pests or used for other miscellaneous agriculture purposes. Examples are bird repellents, insect growth regulators, and insect repellents. And lastly, we have poisons associated with preservation of grains. Example, we have aluminum phosphide and nitric oxide poisoning. So the first agriculture poison is organophosphorus. These organophosphorus insecticides are derivative of phosphoric acid or phosphonic acid. Currently, OP insecticides are among the most popular and widely used insecticides throughout the world. About 50,000 OP compounds are known, of which about 50 are used as insecticides worldwide. Most OP compounds are available as dusts, granules, or liquids. They are often diluted with water before use. Some OP compounds are burned to make a smoke that kills insects. Coming to classification of organophosphorus compounds, they are divided into two, alkyl phosphate and aryl phosphates. Examples of alkyl phosphate is HETP, that is hexaethyl tetraphosphate, malathion, then OMPA, that is octamethyl pyrophosphoramide, and TEPP, that is tetraethyl pyrophosphate. Among aryl phosphates, we have chlorothione, then dizidone, that is also known as TIC20, and methylparathione and parathione. So organophosphorus are well absorbed from the skin, lung, GIT, mucous membrane, as for example conjunctiva, and direct injection. If we talk about distribution, they are widely distributed in the body and they readily cross the placenta. They are lipophilic, thus they cross blood-brain barrier. If we talk about the metabolism, main sites for metabolism are liver and blood. Minor sites include central nervous system, gastrointestinal tract, kidney, lung, and skin. Enzymes responsible for metabolism are A. esterases, carboxyl esterases, fluorohydrolases, and microsomal oxygenases. Coming to mechanism of action. These organophosphorus compounds are powerful inhibitors of carboxylic esterase enzymes, including acetylcholinesterase, that is 2-cholinesterase, and pseudocholinesterase. Organophosphorus compounds are inhibitors of acetylcholinesterase. Acetylcholinesterase is required to hydrolyze acetylcholine to choline and acetic acid. As a result, there is accumulation of acetylcholine with continued stimulation of local receptors and eventual paralysis of nerve or muscle. Organophosphate intoxication lead to characteristic end plate abnormalities that reflect the degree of acetylcholinesterase inhibition and increase in the acetylcholine concentration at the neuromuscular junction. Coming to the fatal dose, TEPP is the most toxic and its fatal dose is 100 milligram orally and 50 milligram IM. If we talk about the OMPA and parathion, the fatal dose is 175 milligram orally and 80 milligram IM. HETP has 350 milligram fatal dose orally and 60 milligram IM. If we talk about the malathion and diazinon, its fatal dose is 1 gram orally. Fatal period, untreated cases, fatal period is 24 hours, while if treatment is given but turned out unsuccessful, then the fatal period is 10 days. Clinical features. Now, clinical features again divided into three categories: acute poisoning, intermediate syndrome, and the chronic poisoning. Among acute poisoning, we have muscarinic effects, nicotinic effects, and the CNS manifestations. So, first talking about the muscarinic effects. So, if we see bronchial tree, then there will be increased secretion in the bronchial tree and there will be bronchoconstriction. Along with this, we have cough, dyspnea, and pulmonary edema. If we talk about the gastrointestinal tract, then nausea will be there, along with vomiting, abdominal cramps, and diarrhea. There will be increased sweating as well as increased salivation and increased lacrimation. Eyes will show miosis, while there will be slow pulse and hypotension. There will be frequency of micturition as well as urinary incontinence. Now, talking about nicotinic effects, among striated muscles, there will be easy fatigability, weakness, muscular twitchings, fasciculation, and cramps. In sympathetic ganglia, we have pallor, occasional elevation of blood pressure, that is hypertension, and tachycardia. Along with it, we have increased adrenal medulla activity. Now, CNS manifestation, initially there will be ataxia, confusion, emotional lability, generalized weakness, headache, restlessness, slurred speech, and tremor. Lately, we have depression of centers, that is respiratory system and cardiovascular system. Along with it, we have drowsiness, hypothermia, convulsions, and coma. Now, talking about intermediate syndrome, sometimes delayed muscle weakness without fasciculations or cholinergic features occurs 1 to 4 days after acute OP exposure. It is termed as intermediate syndrome because it occurred in between the periods of acute and delayed toxicity. Signs and symptoms are upper body weakness, cranial nerve palsies, and areflexia. And the agents responsible for intermediate syndromes are parathion, methylparathion, diazinon, malathion, and monocryptophos. This syndrome may automatically resolve within 5 to 18 days when the body burden of OP metabolites diminish and cholinesterase level normalizes. Now, lastly, chronic poisoning. This chronic poisoning develops months or years after continued exposure. Neuropsychiatric symptoms are the most prominent, which include mood destabilization, anxiety, confusion, drowsiness, irritability, gait disorders, that is Parkinson disease-like symptoms, muscle cramps, paresthesia, weakness, cognitive impairment. Coming to diagnosis, there will be depression of the cholinesterase activity and the levels of both RBC as well as plasma cholinesterases decreases. Among these two, RBC cholinesterase is a better indicator. If we talk about the blood investigation, then RBC cholinesterase activity and hyperglycemia. It can also be diagnosed by thin layer chromatography and urine analysis. Among urine analysis, we have para-nitrophenol test and glucosuria. Now, treatment. First of all, prevention of further absorption. For this, remove the patient from the site of exposure, remove the contaminated clothing, wash the exposed areas with soap and water followed by ethanol in water. Then topical creams and lotions can be applied, and in case of eye contamination, irrigate the eyes thoroughly in running water for 15 minutes. Second treatment or the management part is maintain the airways. It is the most important step, as copious secretion may be blocking the airways. That is a cause of death in OP, that is respiratory failure. So we have to clean the airway of secretions, endotracheal intubation, administration of oxygen, and positive pressure ventilation. Tracheostomy can be done if it's necessary. Third one is removal of unabsorbed poison. For this, stomach wash with 1:5,000 of KMNO4 is given. Coming to the antidotes, activated charcoal can be given, and the dosage is 1 gram per kg body weight. And second one is atropine sulfate. Dosage is 2 to 5 milligram IV every 5 to 10 minutes until complete atropinization occurs. Atropinization means dry flushed skin, pulse 140 per minute, and pupillary dilatation. Pediatric dose for atropine is 0.05 milligram per kg body weight. And a mild degree of atropinization should be maintained for at least 48 hours. Third antidote is glycopyrromum bromide. It is a muscarinic antagonist just like atropine. May be as effective as atropine in preventing death, but with fewer adverse effects, although no adequately powered studies have been done. Moving on to the next treatment procedure, that is oximes. Dosage is 1 to 2 gram in 100 ml of 0.9% NaCl solution given IV over 15 to 30 minutes. They reactivate acetylcholinesterase by attaching to the phosphorus atom and forming an oxime phosphonate, which then splits away from the acetylcholinesterase molecule and prevent the formation of phosphorylated enzymes. They potentiate the actions of atropine, thus decrease the amount of atropine required. Most commonly used oxime is pralidoxime. And lastly, we can control the convulsions with the help of benzodiazepines. Autopsy findings. Autopsy findings are divided into two, external findings as well as internal findings. So first, coming to external findings, there will be signs of asphyxia, such as there will be congestion of face, cyanosis of lips, nose, fingers and extremities, and there will be blood-stained froth at the nose and mouth. Pupils will be constricted. There will be kerosene-like odor from mouth, gastric content and body. Insects and flies die immediately after they alight on an opened cadaver at autopsy. Coming to the internal findings, gastric mucosa is congested, sometimes hemorrhagic. Respiratory passages will be congested, contain frothy hemorrhagic exudate. Heart will be soft and flabby. Lungs show gross congestion, subpleural petechiae, and hemorrhagic pulmonary edema. Brain is congested as well as edematous. Coming to lastly, the medico-legal importance of OP poisoning. Then suicide are very common. Homicide is rare because of a strong smell and bad taste. Accidents are quite common, as for example, Kerala food poisoning tragedy of 1958 and Bihar midday meal tragedy of 2013. Organophosphates resist putrefaction, so can be detected in the viscera for quite some time after death. Organochlorines are organic compounds containing at least one chlorine atom, which are used as insecticides. They are non-selective insecticides, that is, they kill all insects it comes in contact with. They are also dangerous to human beings and carry enormous environmental risks. Coming to classification of organochlorines, one is DDT, that is dichloro, diphenyl trichloroethane and related analogs such as methoxychlore. Second one is benzene hexachloride or lindane. Third one is cyclodines and related compounds, example aldrin, dialdrin, endrin, endosulfan, chlorodane, chlorodecone, heptachlor and isobenzene. And lastly, we have toxaphene and related compounds. Coming to toxicokinetics, first, absorption. All organochlorines are well absorbed by ingestion and inhalation. Metabolism, they are metabolized by the hepatic microsomal enzyme systems by dechlorination, oxidation with subsequent conjugation. Coming to the excretion, so primary route of excretion is bile, while most of the organochlorines have significant enterohepatic or enteroenteric recirculation, example chlordecone and Mirex. They are excreted in maternal milk because they are lipophilic. Mechanism of action. So organochlorines selectively bind to open, that is activated sodium channels and slow their closing, that is inactivation, thus allowing the influx of sodium ions. The continuous inward ion current causes depolarization and repetitive firing of the nerve membrane. This is clinically seen as a prominent tremors. Fatal dose for aldrin, dialdrin and endrin, it is 2 to 6 gram. For DDT, lindane or gamma hexachlorocyclohexane or gammalin and gamaxane, it is 15 to 30 gram and fatal period is 1 to several hours. Coming to clinical features, first acute poisoning. In acute poisoning, first we have prodromal signs or symptoms, which include agitation, confusion, dizziness, headache, hyperesthesias and paresthesias of the mouth, tongue, face and extremities. Nausea and vomiting will also be there. Among CNS stimulation, we have myoclonus, tremors, and seizures. Hypothermia occurs due to increased muscle activity and aspiration pneumonitis. Pupils will be dilated and there will be respiratory failure and death. Chronic poisoning symptoms include ataxia, exaggerated startle response, intracranial hypertension, oligospermia, opsoclonus, that is rapid, irregular, dysrhythmic ocular movements, tremor of head, hands, and even entire body, that is known as keep-on shakes. Then we have weakness, weight loss, increased liver enzymes, and lastly, decreased sperm motility. First of all, measures for rescue personnel and bystanders. They should wear protective gear, as for example, apron or gloves, etc., because organochlorines may be absorbed through skin. Then we have immediate resuscitative measures should be given. The patient should be moved from toxic environment to the fresh air and monitored for respiratory distress. Then comes decontamination. That is, if contact is there, then wash the skin, hair, nails, eyes, or other exposed area copiously with water. And if ingestion is there, give the emetics as well as the gastric lavage. Then the treatment part includes activated charcoal and cholestyramine. Now, what this cholestyramine is? It is non-absorbable steroid binding ion exchange resin. It increases the fecal excretion of organochlorine and the dose is 4 gram QID, that is 16 gram per day, orally mixed in fruit juice for 2 weeks. Symptomatic treatment include management of hyperthermia and seizures. And lastly, we have to give calcium gluconate. Autopsy finding: mouth and stomach contents smell of kerosene. There will be sign of asphyxia and the liver will show centrilobular hepatic necrosis. Lastly, the medical importance of organochlorines. Suicide is common, homicide is rare because of strong smell and bad taste. Accident is quite common. And occupational exposure leads to suits for compensation. Andrin resists putrefaction and hence can be detected in the viscera for quite some time after death. There are few organochlorines which are banned in India for manufacture, import and use. They are aldrin, chlordane, dieldrin, andrin, hepatochlor, lindane and toxaphene. Carbamates are organic compounds derived from carbamic acid. They are marketed in the form of dusts or solutions. Example, LD-carb, aminocarb, carbaryl, carbofuran and propoxer, that is Bagon. Coming to the classification of carbamates, so they can be either highly toxic or moderately toxic. Highly toxic includes aminocarb, bendiocarb, benfurocarb, carbaryl, carbofuran, dimethane, dimethylene, dioxacarb and formatinate, along with methiocarb, methomyl, oxamyl and propoxer. Moderately toxic carbamates are LD-carb, bufencarb, carbendazim, isoprocarb, metolcarb, pimicarb and trialate. Toxicokinetics. First, absorption. They are rapidly absorbed from the small intestine or on inhalation. They are metabolized in the liver, and coming to excretion, they are excreted in urine within several days. LD-carb undergoes extensive enterohepatic recirculation. Coming to the mechanism of action, carbamate causes reversible inhibition of acetylcholinesterase, due to which there is accumulation of acetylcholine at muscarinic and nicotinic receptors and in the CNS. Clinical features. So, clinical features of carbamate poisoning are same as that of organophosphate poisoning, but there are few differences, such as carbamate causes reversible inhibition of acetylcholinesterase. Therefore, the signs and symptoms are less severe than organophosphate poisoning. Carbamate toxicity is short-lived and it hydrolyzes spontaneously from the site. And lastly, it does not penetrate effectively in CNS, so it produces little or no CNS toxicity. Coming to the treatment part, which is divided into decontamination, antidote administration and supportive measures. First, decontamination. So, if any skin exposure is there, the affected part should be washed thoroughly with copious water. For ocular exposure, copious eye irrigation with normal saline or tap water. And for ingestion, we have to give gastric lavage as well as administration of activated charcoal. Antidote, atropine 2 mg intravenous promptly with dose repeated every 10 minutes till the sign of atropinization. And the supportive measures include oxygen administration, ventilator assistance, and maintain the vital parameters as well as the hydration. Autopsy findings. Autopsy findings include insecticide like smell, froth at mouth and nostrils. There will be cyanosis, constricted pupils, congestion of organs, pulmonary edema, as well as the cerebral edema. Lastly, the medico-legal importance of carbamates. Accidental poisoning may occur. Suicidal poisoning is also common with this insecticide. Homicidal is rare as it is difficult to mask the smell of insecticide. Now, pyrethroids or pyrethrin or pyrethrum. What are all these three terms? Now, pyrethrins are natural insecticides produced by chrysanthemum plant. They are neurotoxins which attack the nervous system of all insects. So, this pyrethrum is a powder made from dried flowers of chrysanthemum. They are composed of 6 naturally occurring esters, 2 of which are referred to as pyrethrins, that is pyrethrin 1 and pyrethrin 2, the other being known as cynerins, that is cynerin 1 and cynerin 2, and jasmolin, that is jasmolin 1 and jasmolin 2. If we talk about pyrethroids, they are manufactured chemicals that are very similar in structure to the pyrethrin but are more toxic to insects as well as to mammals. Mechanism of action. Pyrethroids prolong the inactivation of the sodium channel by binding to it in the open state. These compounds quickly inactivate the insects, but mammals are relatively resistant to them. However, in most of the cases, toxicity with these agents occur because of the allergic reaction to these compounds. Clinical features. First, the dermal exposure. It causes erythema, dermatitis, blister formation. Ocular exposure causes irritation as well as lacrimation. Inhalation causes rhinorrhea, sore throat, wheezing, cough, and dyspnea. Ingestion causes nausea, vomiting, paresthesia, vertigo, fasciculation, hypothermia, altered mental status, convulsions, pulmonary edema, and coma. Treatment part includes decontamination as well as treatment of systemic poisoning. First, decontamination. First, skin exposure. The affected part should be washed thoroughly with copious water. And for ocular exposure, copious eye irrigation with normal saline or tap water should be given. If we talk about the systemic poisoning, in systemic poisoning, if ingestion is there, then give the gastric lavage along with the activated charcoal. For allergic reaction, give the epinephrine and antihistamines. Bronchospasm treated with appropriate bronchodilators. For convulsions, give diazepam. Along with these all, oxygen administration as well as ventilator assistance should be given. Coming to autopsy findings, insect repellent like smell will be found in pyrethroid poisoning, then froth at the mouth and nostrils. There will be cyanosis, congestion of organs, pulmonary edema, as well as there will be cerebral edema. Lastly, the medico-legal importance of pyrethroids. Accidental poisoning can occur and suicidal poisoning is very rare. Aluminum phosphide is a lethal solid fumigant, pesticide, insecticide, and rodenticide. It is common outdoor and indoor pesticides in developing countries like India, as it is cheap, effective, free from toxic residues, and does not affect the seed viability. Considered an ideal grain and tobacco preservative in India. It is available as dark brown or greyish green tablets of 3 gram each. Also available as 0.6 gram pellets. Tablets are composed of pure aluminum phosphide, the active ingredient, and ammonium carbamate or carbonate or urea. Tablets of aluminum phosphide are sometimes referred to as rice tablets. Phosphine on contact with moisture, each 3 gram tablet liberates 1 gram of phosphine, which kills insects and rodents in all stages of development, along with carbon dioxide and ammonia. It is available in India under following trade names: Alphos, Bidfos, Cellphos, Fumigram, Phosphotec, Phosfume, Phostoxin, and Quickphos. Coming to toxicokinetics, absorption. From GIT, rapidly absorbed from GIT by simple diffusion. Lungs, phosphine liberated from aluminum phosphide can be readily absorbed through lungs. Talking about the metabolism, some aluminum phosphide is transported to liver where it is slowly metabolized to phosphine, accounting for prolongation of symptoms. This phosphine is oxidized to oxyacids. It is excreted in urine as hypophosphite and also through the lungs in the unchanged form. Now, mechanism of action, that is formation of phosphine. How it is formed? On coming to contact with moisture present in the air or with HCl and water in the stomach, aluminum phosphide liberates phosphine, leaving behind aluminum hydroxide or chloride, which is a harmless and non-toxic grayish-white residue. So, in air or stomach, aluminum phosphide will react with water, and in stomach, it will react with hydrogen chloride. So, this phosphine is a protoplasmic poison interfering with enzymes and protein synthesis. Coming to clinical features, there will be metallic taste, vomiting, thirst, burning sensation, pain in abdomen, diarrhea, persistent hypotension with shock, dyspnea and cough. Along with there will be tachycardia, tachypnea, bleeding diathesis, restlessness, altered sensorium, coma and respiratory distress. Treatment of aluminum phosphide poisoning. First of all, secure the airway. Oxygen ventilator assistance should be given. Manage the shock with intravenous fluid and inotropic support. Manage the metabolic acidosis with sodium bicarbonate. Magnesium sulfate administration remains controversial. It is said that administration of magnesium sulfate is beneficial for management of cardiac arrhythmias. Gastric lavage is contraindicated since administration of water will release phosphine from the available aluminum phosphide in the stomach. Now the autopsy findings. There is typical garlicky odor. Organs will be congested, bright fluid blood, pleural effusion and pulmonary edema. There will be toxic myocarditis, bleeding diathesis. Gastric mucosa shows shedding, kidney shows acute tubular necrosis, liver shows fatty changes, congestion, edema, inflammatory, infiltrate in portal tract and centrizonal necrosis. Lastly, the medical importance of aluminum phosphide poisoning is suicidal and accidental. So, this suicidal poisoning is common with this agent, especially in the northern part of India. And rarely accidental poisoning may occur to workers working in grain elevators, warehouses and grain freighters. Next agriculture poison is paraquats. So, these paraquats are popular herbicides. They are spread on unwanted weeds and other vegetations. Paraquats and diquats belongs to dipyridyl group. Now, clinical features of paraquat poisoning. So, paraquat causes corrosion to mucosa of mouth, esophagus and gastrointestinal tract. It causes pain in mouth and in abdomen. There is diarrhea, vomiting, dysphagia and aphonia. Patient develops hepatic failure and renal failure. There may be metabolic acidosis with hyperglycemia. Lungs shows pulmonary edema and after 4 to 5 days may show pulmonary fibrosis with progressive respiratory failure. Coming to the treatment, gastric lavage with activated charcoal may be beneficial if performed within 1 hour of ingestion of poison. Pain should be controlled by giving ice-cold fluid and parenteral analgesics. Hemodialysis or hemoperfusion is said to be beneficial, and the supportive measures include maintenance of airway, circulation, hydration, urine output, and vital parameters. Autopsy findings. There will be corrosion around lips, mouth, esophagus, and erosions in GIT. Lungs may be edematous or may appear stiffened with evidence of hemorrhage and pulmonary fibrosis. Liver shows sign of hepatic failure and kidney shows acute tubular necrosis. Other organs will be congested. Thank you.